Welcome to After the Call, the podcast dedicated to the stories and struggles behind the badge, the turnout gear, and the uniform. Each week, we'll bring you a powerful conversations with first responders, mental health professionals, and advocates who are breaking the stigma, sharing their journeys, and offering real solutions. We'll talk about PTSD resilience, family impact, and the resources that can make a difference. Because the job doesn't just leave scars on the body, it affects the mind, the heart, and the people who serve alongside us. And no one should have to carry that burden alone. This is After the Call, where you'll find strength through resilience.
So thanks for another episode or showing up for another episode of After the Call. I am your host, Patrick, along with Veronica, and we have Jason and Jamie Cole. And we'll talk a little bit about your guys' business and stuff like that and how we kind of got in contact with that, which I'm a big fan of because I have used it, not yours specifically, but I have used it and I've seen what it does. So it's actually pretty cool. Nice. So if you guys want to introduce yourself on what you guys, like the name of your business and then kind of what brought you into it.
Okay. I'm Jamie Cole. I'm physician assistant and co-founder of White Lily Wellness with my husband, Jason Cole. I come from a background of 20 years of emergency medicine as a PA, and before that I was a nurse for 4 years. So over 25 years of emergency medicine service. And we established White Lily Wellness. I did a little bit of aesthetics, and about a year into business, we added hyperbarics because it helped with Jason after an injury. And we'll get into that.
Mm-hmm. Yeah, I'm Jason. I'm a flight paramedic. I've been in EMS about 20 years as a paramedic, whether it was on the ground, on a fire engine, most recently on a helicopter, airplane, doing flight medicine. And 3 years ago, when was my accident?
Yep.
About 3 years ago, I had a motorcycle accident on my Harley. And I was in the hospital for several weeks, another week of rehab, 2 years of healing. One of my flight nurses who lives in Kanab, Utah, actually has hyperbaric chambers. I was in leadership and traveling around a couple different states, and he's like, "You got to come try this." I'm like, "Okay, next time I'm up in Page, I'll try to come see you." I did a treatment. I don't know. I think Jamie said, "How do you feel?" I'm like, "I don't know. Kind of weird. I feel better. I think I feel better." And that was our start of hyperbarics, like our first intro into hyperbarics, what it does, what it looks like, how it feels. About that exact same time in our life, we were talking about building a business. We were talking about her aesthetics business, building something for her. We were talking about a machine, a device. How do we add something to this business to help it grow? We looked at lasers and a few different things, and we settled on hyperbaric chambers. So we ended up buying 2 of them. They're hospital grade, FDA approved, like all the stuff. They're really nice.
Yeah, big hard shell.
Yeah, the hard shelled.
Yeah, we didn't want... There's 2 types of chambers out there. There's soft shells and hard shells, and they're good for different things. Mm-hmm. And coming from a hospital background, and Jason was in safety management a lot, we wanted devices that were medical grade, hospital grade, safe, cleared by all of the right governing bodies, because safety is very forward at our practice. We know there's been some couple incidences recently, and we want to make sure that people are safe and comfortable with us.
So getting into the nerd stuff of this.
I love nerdy stuff.
So let's nerd out for a minute. So when we're talking about what the hyperbaric chamber does on a first responder level. So let's say I came to you, right? Suffer from PTSD, I can't sleep, night terrors maybe, body aches, all the typical stuff you might see. What kind of protocol would you throw me into, and what would that protocol do for me?
Absolutely. So first and foremost, oxygen is a drug. It does require a prescription. So if you're in a hard-shelled chamber and you're receiving oxygen, you should have been cleared by a medical provider. So we would schedule a consult. We would look at your past medical history, your surgeries, your injuries, your medications, if you have devices implanted inside of your body, and then we give you medical clearance. Number 2 is deciding what is the atmospheric pressure that you needed to be treated at based on your injuries and based on the studies. So a lot of your injuries are long term. So you've got some chronic pain, your anxiety, the stress in your brain. And the studies show that treating between 1.5 and 2.0 absolute atmospheres is the protocol for that. If you were in an acute injury situation, like you also fell and broke your hip, then we would be looking at remodeling your bone. So we would need to go up in pressure.
Okay.
Hyperbarics, with one session, you might sleep a little bit better and you may feel a little lighter because we effectively infused oxygen into your plasma. But it's the on gas, off gas sequencing that changes your body's response and really changes your DNA matrix in your body. So to start from a PTSD standpoint, a treatment protocol would be 20 treatments, 20 days in a row, as close as we can do that. We do tend to be closed on Saturdays and Sundays, but if there's acute emergencies, we will show up. So generally it's a 5 and 2 protocol. So you're looking at a month, and that treatment time is 60 minutes. Treatment time at pressure. So when we close the door, the pressure starts to go up, and that is not included in your 60 minutes. So you're really under pressure from 70 to 80 minutes. It's just you're not at your treatment level. So that would be the start. And then we use some scoring mechanisms to help us decide how your mental health is improving. So PSL-5 scoring sheet, there's 20 questions, 1 through 4. We get your baseline score before treatment, and then we score you every 10 treatments and make sure that that number is going down.
Now, you brought something up when we were talking about my situation or whatever, but you said like if I had to rebuild a hip,
Yeah.
right? So now you have a couple different treatment protocols that you're working with. So which takes priority?
What takes priority would be trying to think of how to say this. Your brain would take the priority. Okay. If you have, I'll just call it a brain problem, whether that's a TBI, a concussion, PTSD, that's all in your brain. We need to treat your brain first before your bone.
Okay.
So you'd be treated at lower pressures first, get that under control, get that going, and then we'd start into the higher pressures to treat the bones.
Is there something adverse that would happen if you did it backwards?
No.
Not at all. There's actually a bunch of literature and studies out about simply being under pressure, you're getting benefit. Whether that's a low pressure, a high pressure, with oxygen, without oxygen, you're actually getting benefit just being under pressure. So the pressure does matter, but in the big scheme of things, I don't think it matters as much as most people think. Our treatment times, like she said, are 60 minutes long. That doesn't include time to pressure or time out, but as soon as the door shuts and the compressors are on, your body's getting benefit instantly.
All right.
So what happens, what do you feel when you're in there? I've never done this, so this is all.
You're going to come and do
She's
it.
got a bad attitude.
Oh, no, don't have a bad attitude. So from what does your body feel like? The number one risk and the number one thing that you will feel has to do with your ears. So barotrauma, or trauma to the eardrum itself, because of the pressure, you need to be able to clear your ears. So similarly to scuba diving or going up in a plane, you need to be able to pop your ears, swallow, yawn. We've got small bottles of water that are safe for being in there. We don't allow food because of choking hazards. But we want you to clear your ears. That's really the only place that you feel it. Mm-hmm. Other than that, it's calm. You'll hear the compressors running. We can put on some binaural beats to have a relaxing environment, but you don't feel pressure on your body, right? Our chambers compress with room air, and they off gas with what you've expelled, breathed out, plus the room air that we compressed with. So you're not heavy in there. You can be in there. You can lay back. You can have bolsters under your knees. You can have pillows under your arms. You can read a book. You can journal. No electronics in the chamber. So, and you just chill. No emails, no texts, no kids, no animals.
It's serene. It's serene with some white noise. It's the best way to describe it.
Yeah.
As long as you can clear your ears and pop them until you get to pressure. Once you're at pressure, you don't need to pop your ears anymore because we're not adding any more pressure.
Yeah.
Once you're there, we put a timer in the window so you know you're at pressure, you know when your 60 minutes starts, and you just relax. We've got so many people that come and want to take a nap.
That's usually what I would do.
As adults, we don't take naps anymore. We're too darn busy. And you start taking naps and you realize, wow, we have a patient who's a mom of young kids. She works all day, and it's like her best hour of her day to come and take a nap before she has to go home and be a mom and wrangle the kids. Everybody loves taking a nap. It's nice. And we try to make it incredibly comfortable and for you. Bolsters, pillows, blankets, like she said.
Yeah. Yeah.
All right. So going back to your injury, motorcycle accident?
Motorcycle.
So how did you kind of get into this idea after that injury?
Just from treating at my friend's chamber. We decided this would be a good thing to do. We started doing the research, reading the research that's been done on it. I had a TBI, so I had a lot of brain fog, a lot of memory issues, and then I had broken bones as well. So we started treating me for my head, for my brain. I'm a typical dude. I don't pay very much attention to myself or my changes, but Jamie noticed them. And she would tell me all the time, like, hey, you're being a lot nicer today. Hey, you're a lot happier today. And so that told me it was working. I continued. All my bones, fractures, all my metal in my foot, everything feels great. Everything feels healed, so much so that I try to run 6 miles every week, even after not being able to walk because of everything that happened. So, yeah, that was it. I continue to treat, continue to tell people about my journey, to try to inspire them to get in the chamber. And it's amazing some of the people we've seen come through our clinic. We've physically seen healing. Like, I don't know how else to describe that. It's neat. We've seen mental changes. We've seen bone changes. We've seen changes in patients that have had cancer treatment, like the spectrum. It's mind-blowing.
So to the individual that thinks this is, and I'm trying to be just general terms. So the person that feels this is too woo-woo, what would you say to that type of mentality when you're like, hey, you should try this because it does work, and they're like, it's oxygen, like, what's it gonna do? You know what I'm saying?
Yeah. So from like our personal experience, I am an A personality, bullheaded, stubborn, yell, whatever. He is calm, collected, and keeps me in check, right? And after his accident, he was grumpy. And there were days that I was like, whoa, I don't even recognize that face that you're looking at me with anger and frustration and restlessness. And hyperbarics brought the calm back. He's like, I don't even know what that was. It's dumb, whatever. I was in there. And I was like, okay. But within 3 days of one treatment, he wasn't tossing and turning in his sleep. He wasn't snoring as bad. He talked a little bit in his sleep after his accident. He wasn't doing that anymore. And that's just the brain fog of having a head injury. From a woo-woo perspective, if you really want to anchor on drugs or the thing, oxygen is a drug. So there you go. You're getting a prescription for a drug, right? We also have to remember that our brains are trainable, and they only know what we tell it. So if we're filling our brain with crap, then all of our brain is going to see is crap. If you drive a white car, you're going to see white cars. If you're sitting in anger and rage, you're going to find anger and rage, right? And we try to be the people and the providers at our clinic that allow you to be in your anger and rage, but we also say, you're going to get in that chamber, and I'm not going to let you listen to your rage music. You actually need to put on a positive podcast. You're trapped you're trapped for your 60 minutes, right? And so it's a little psychology too. So yeah, is it woo-woo? It's not conventional. There are 15 on-label clinical indications for hyperbaric therapy at a hospital setting. Unfortunately, mental health is not there yet.
Right.
There are huge studies around that. We're all stressed. We're all anxious. We're all on our phones too much. It's not woo-woo. It's real. Hyperbarics is one of the only things that will lengthen your telomeres. Your telomeres are the end caps on your DNA that protect who you are. So it's not woo-woo. There's science behind it. We just don't talk about it.
And that's why I was trying to find the right way to say it, because a lot of people do think it's very unconventional. And
Yeah.
I mean, that's not the first thing you would think of when
No.
you're like, hey, I'm
No.
not sleeping good. I'm not, I'm angry at home or whatever. Like, let me go sit in a chamber. Like, that's not what you would typically think of.
Right.
And the first thing most mental health providers would do is like, hey, let's get you on some SSRIs. Let's do this. Let's try this. Go talk to somebody. And you're like,
Yeah.
that's not even working. So
It's not. So we encourage people to journal. We encourage them to write about their journey. We like them to pick their own podcast music, but we also have podcasts that are uplifting. I try to establish a texting relationship with the patient, and if they just are having a bad day, like they're allowed to text me and they're like, I need a cheerleader today. And then I will send them back a funny meme or something to uplift them. So we don't get that anymore. We don't get the positive reinforcement anymore. So along with hyperbarics, we try to promote those brain changes so our brain will look for positivity. So
I feel like most of our patients, if somebody came to us and thought it was woo-woo and had lots of questions, I'm positive most of our patients would come in and speak to them about their experience. We've got people chomping at the bit. We have a patient of ours who's like, how can I help? How can I help? Can I talk? Can I be a testimony? Can I do this? He is constantly trying to help. We have so many great stories, so many people that will tell their story, how they feel, why they did it, whether or not they believed in it, and the results they saw. So if anybody wanted to reach out, we got tons of people to talk to them.
yeah.
no, I think that's great. With the first responders that may not necessarily be dealing with something firsthand, but they have a spouse, a family member who is dealing with other chronic issues, lupus, MS, whatever.
Yep.
What would you say to those types of folks? Because I know that's obviously an additional stress to the household, but how would this work in cases like that?
So off-label treatment protocols exist for Lyme, mold. They're up and coming for autism, for mood regulation. Getting them in to talk is the easiest way so that we can talk about their specific situation, what they've already tried and what they haven't tried. From even just a general wellness perspective, it can be great for your athletes. When our nervous system is stressed and we're in a constant fight and flight, our brain can't actually sort the files on safety. We need the rest and digest for our brain to settle down and for our body to remodel. And so for our mitochondria, which are the powerhouse energy levels of our cells, to remodel and recharge, we actually need to rest. We need to sleep. We need to take a break. We need to not be stressed. And so stress regulation is really helped with hyperbarics. From a Lyme disease perspective, sometimes those patients will get 1 to 2 treatments and feel a little bit worse because of the spirochete shedding. So based on each individual protocol, I tell the patients what they should expect to feel in their body. Yeah, but yeah.
Is there any patient who's this is not for?
Yeah, absolutely. So the number one contraindication is if you have spontaneous collapsed lungs. So it's called a pneumothorax. So those patients are at higher risk for collapsing their lungs, more on the decompression portion of hyperbarics. And then there's 2 chemotherapy agents that we have to be mindful of, doxorubicin specifically and cisplatin. We can change those chemotherapy agents to work bad in your body. There's some seizure medications that we just have to watch for seizure threshold. But from our chamber standpoint, we have monoplace chambers, so one person can get in there. We've treated as young as 9. So as long as a kid is mindful enough to not touch our nozzles, they can get in and follow directions and clear their ears. So those are the highest contraindications for not getting into the chamber. Yeah. We've had patients with brain cancer that have gotten in there, and we just have to put signs over a knob so they wouldn't reach up and grab it. So, yeah. Anything I missed?
No?
No. We don't let people get in intoxicated or things like that. Obviously, that's a risk, but
Yeah.
And you guys have medical staff on site.
Medical staff on site. All the emergency medicine you need.
So when someone's in there, do they have contact with you while they're in there, or are they just on their own?
They can communicate via, we've got writing pads in there. They can write us notes. If they really need the verbal communication, we can put
It's basically a CB mic, and I've got it plumbed through the side of the chamber to a walkie-talkie. So the walkie-talkies and the batteries stay outside of the chamber. We don't want batteries inside, but we can put a CB mic in there, and we can talk to them physically just like this.
Yeah.
We try to not just leave it in there because we try to not clutter up the inside of the chamber. But if you really need it, we'll put it in there. Most of it's just hand signals. Okay. Hyperbarics has a big start in scuba diving. So I'm a scuba diver, so I ask everybody, "Are you okay?"
Yep.
You know, you give them the okay sign. You can respond any way you want, with your head, with your thumbs, whatever, but I have to know if you're doing okay, if your ears are clearing, and if you're doing okay.
Okay, and that was my thing.
Yeah.
So one of my first thoughts was my son, when he was younger on airplanes, his ears would not clear, and he would like freak out, and I was always so worried his eardrum was going to burst or something. It was awful. And so I just didn't know if that was something when you're in there, if something like that is happening, are you just stuck or okay?
No. So I'm usually the one watching you, and
Okay.
especially on your first time, I'm staring at you almost the whole time, kind of creepy. But I want to make sure that you're comfortable, make sure that your ears are clearing, because we can do damage.
Okay.
Even if you're telling me you're doing okay, I can kind of tell that you're not. If you're wincing and you just can't quite clear your ears, I can tell. So I'll stop. I'll stop putting pressure in there, let some out. If I have to undo everything and climb in there and ask them, "Are you doing okay? Are you clearing?" And they're like, "Well, I have a little pain." I'm like, "A little pain's too much.
Okay.
Let's stop. Let's figure this out. Let's coach you better." But yeah, we would watch him really close to make sure that he doesn't get hurt.
Okay, gotcha.
You gonna try it?
Yes.
Sure.
Here's
Sure.
me. Yes.
She needs to try it. I want to try it too, but
Yeah.
but there's windows. You can see out.
Well, yeah, I didn't know. I've never seen.
It's
or
not just
been
a
around. It's not this
enclosed
like
tube.
capsule.
Well, I mean, it's enclosed, but like there's windows like in the front and sides, right?
There's some windows. So there's
like
many
little
different kinds of
ports.
chambers. Yeah, ours are steel with little round windows, little round ones.
mini
There are,
submarine.
there are some manufacturers that build their chambers out of acrylic, like the whole thing is clear.
Wow.
And some people really like that. Some people feel like they're on display for the whole clinic because you're like out in the open.
Yeah.
But either way, yeah.
Very cool.
And you guys don't have a soft one. It's just the 2 hard, right?
Just the two hard ones. We want to grow and expand. We want more hard shell chambers, actually. And we want our next purchase to be a multi-place chamber, meaning more than one person can get in. So you could get in with your son, coach him, be with him, talk to him. If we had a brain cancer patient that needed a lot of assistance, we could put them in there with a nurse or with a caregiver. It just opens up us to treating more and more people, to reaching more and more people. So hopefully sooner than later, we'll get one.
Yeah.
That was my first hard chamber. Was like one of those multi-personal.
Multi-place.
And there's like this big thing, and I'm just sitting there by myself. And,
Oh.
Yeah, you're in there by
all right,
yourself.
cool. But yeah, it's kind of funky, but it is very relaxing. Once you get to pressure, like you just like it
Chill.
almost just
You can close
like
your
everything
eyes.
just like settles. It's kind of a weird feeling.
It's white noise, and you don't have any distractions. We are distracted 24/7 with our phones, emails, notifications, Facebook. You don't have any of that in there. Actually, the first time people are like a little anxious because they're used to holding their phone and scrolling on something. They can't do that.
Yeah.
So you learn. We've had so many people read books, multiple books. They're like, "I haven't read a book since high school, and I just finished 4. Mind blown. We're starting a small library because sometimes people forget their books, or there's a new book there. We've had patients donate books. We've got a whole bunch.
Sweet. So where can we find you? All that stuff, because we obviously have our resource page, and we put all of our people that we refer.
So
we
we're in
recommend
Chandler,
stuff.
Chandler and McClintock.
Okay.
Our website is whitelilywellness.org, O-R-G.
90 North McClintock. We're 1 mile west of the Chandler Fashion Square Mall. We're in a medical plaza in suite number 3. Yeah.
And then if we had somebody that wanted to reach out to you today, how soon could they as long as they're medical cleared, like how soon can they get into treatment?
We have openings next week. We can do about 50 treatments per week. And the week tends to like fill up on Fridays, if that makes sense, because patients get their prescription for 20 or whatnot, then they'll do 2 weeks at a time, you know, because that's what their life allows. But Friday of last week, I think we had 3 people scheduled, and we've done 22 treatments this week. So it really it exploded for whatever reason.
Yeah.
So yeah, people that are staging for surgery, getting hyperbarics before surgery helps to oxygenate your tissue so that your tissue is primed when the surgeon goes to cut it. And then coming in after surgery, you can grow new blood vessels, you can improve those nerve connections, you can decrease your scarring, you can decrease your wound healing time. If your family members had a stroke, strokes are blood clots in blood vessels that change the dynamics of blood flow into distal extremities. We can push gas past the clot and get those tissues moving again. So we've got openings next week. We'd love to have people.
One last question I have,
Sure.
since I'm always asking questions. What about people that use like peptides and stuff like that? Does it have any issues like
No.
with like the BPC or anything like that?
Nothing.
No issues.
Cool.
No issues. The major drugs are chemotherapy and then drugs for alcohol abuse and abuse. We can't, and so, there's a specific sulfa drug that they can't. But if they're on like the sulfa-based antibiotic, no. But it's a specific drug for addiction.
Wow.
Yeah.
All right.
Yeah.
Yeah.
You better schedule.
I know. I need to. I'm gone for a couple of weeks, but after that.
There you go.
Sweet. Well, we appreciate you guys coming out.
Thanks
Yeah.
for having
That's
us.
awesome.
Yeah.
We'll have to have you guys back on down the
Yes.
road to see if anybody tried it.
If anybody's
Yeah.
curious, I always tell people it's free to come look.
Yeah.
Just come check it out.
Yeah.
Very cool.
We do have some scholarship money for veterans. So if someone is a veteran, we have some help that way. And then we also are in with the 100 Club.
Yeah.
And so anybody that's part of the 100 Club actually has hyperbaric benefits for mental health. So it's a good thing to know about. So if the financing is an issue and you're part of the 100 Club, you can get help through Rainey Crabtree, I think is their last
Yep.
name. Yeah, and or their East Valley provider for hyperbarics.
Sweet.
Yeah,
Cool.
Awesome. Good to know.
Yeah.
Yeah.
Definitely.
All right. Well, thanks for coming out.
yeah. Thank
Thank
you
you.
so much.